For those of us who've been lucky enough to find what feels like a second home in the workplace, we know how important work relationships and the support of our employers are to our professional and personal lives. And joining me today to tell us about her experiences as a career nurse and the culture and compassion at Emerson Hospital is Wendy Repucci. She's the surgical care nurse manager at Emerson. This is the HealthWorks Here podcast from Emerson Hospital. I'm Scott Webb. Wendy, it's so great to have your time today. Can't wait to learn more about you as we get rolling here. What do you do at Emerson, and how long have you been there?
I am a nurse manager in the peri-op department, so I oversee the recovery unit, also known as the PACU, pre-op and post-op day surgery, the pre-surgical testing unit, and then the spine center. I've worked here for 29 years, actually.
29 years, that's amazing. I'm sure you've had so many amazing experiences over the years, and just want to get a sense. When folks say they've been someplace like Emerson for a long time, there must have been a lot of good reasons why you stayed. Maybe you can share some of them with us.
I had pride in Emerson Hospital even before I started working here. My father was the chief boiler tech here at the hospital for over 30 years himself before he passed away, but he was well known and just a real staple of the hospital, and I got to know the hospital because of him. And I remember as a kid coming up and dropping off his lunch and things like that. But then also when I went to nursing school, one of my clinical rotations was here at the hospital as well, so I really got to know the hospital at that time and enjoyed it. I thought it was a great hospital. It was a comfortable learning environment. The people were friendly. And at the time, we had this chief nursing officer who had this skill of knowing people's names. Her name was Leslie Luppold. She would walk in the hall and always address you by name, and just hundreds and hundreds of nurses, and she would never forget who you were. And actually, she came to speak to my college back in the day, and I was so moved by her presentation. She was doing a presentation on swimming with the sharks, and she said it's actually similar to being a nurse and sometimes trying to navigate through difficult times. And after the class, I went to her and I said, I really would, love to work at Emerson someday. I was putting a plug in considering I was finishing up nursing school. And she says, well, you work hard and stay the course. I'll see you in the halls. And she took my name down or whatever. So months and months later, after I passed my boards and applied for the job and I got the job, I saw her in the hallway and she stopped and she said, you made it. I was blown away that she remembered me from just a brief discussion after she presented to my school, and she just had this knack. So I was thinking, boy, I really want to be like that person someday. So that's how I got here.
That's so cool to hear about that family connection, just every day as you're walking the halls thinking, Dad walked these same halls. I used to bring him his lunch when he worked here. That's so cool, so heartwarming. Maybe you could describe, it sounds like you're talking about her in particular, but in general, what's the culture like at Emerson, especially for nurses?
It may sound cheesy to say that we're a family atmosphere, but we truly are a family atmosphere here. We really rely on each other and each other's strengths and abilities. We have strong relationships. And speaking of the family atmosphere, they showcase the family within the Emerson family. And of course, my dad was here at the time and they had a picture of me and my father. But there were a lot of husband-wife teams, sisters, brothers. It was really interesting that there were so many connections like that. And I actually met my husband through my mother-in-law, who was a nurse here. And we've been married for 25 years. So it's funny how things work out. But the Emerson culture is hard for me to say that it's different since this is really the only place that I've ever worked in my nursing career. But I've had a lot of nurses come from other places and they just say that it's just really remarkable and it's extraordinary. People really band together and help each other, and the nurses here are highly committed and highly devoted. I would say if I had to say a word for the staff here is assiduous. They show great care and perseverance, especially during the pandemic. The important thing for them to remember, and I always tell them, especially when we're at our lowest points and we're tired of testing patients and dealing with the COVID positives and all the extra work that goes around with it, I have to remind them that we are really part of something that's really big, that history has been made, and they have to be proud of what they do. And I think they are.
I'm certain that they are, and I can certainly hear the pride in your voice. And COVID has tested everybody's resolve, especially those of you on the front lines. So thank you for that and making it through and helping us. And as you say, really a part of history and sounds like really part of a family there at Emerson, which is just really nice to hear. I'm sure you have many favorite memories over 29 years, but maybe you can share at least one of them with us.
Well, I do have a favorite memory. So our CEO, Chris Schuster, it was her first day on the job, and I saw her out in the parking lot, and I actually went up and spoke to her and welcomed her. And, I thought, okay, I'm just going to scamper off now and go to work. And I did the right thing. She's never forgot that. And she brings it up time and time again at various meetings or when it's appropriate. She always talks about the very first nurse that she met at Emerson Hospital was me. And she says that when she's done here someday, when she retires, she wants me to be the last one that sends her out. So that to me was really, heartfelt that I did the right thing at that moment, and it showed. So it was great. But I also had some sad times here that stand out. I had a patient over 20 years ago or so. Her husband had received some really grave news, and it was a really sad moment that night when I was caring for them. I was a young nurse. I didn't have a lot of experience with death and dying, but I just felt so helpless for her. And I don't know what I wrote, but apparently I wrote her a note, and I'm not even sure what I said to comfort her. But years later, and I was working in the surgery area at this point, so it was 10 or 15 years later, she reminded me that she still had that note, and she said that every time she's going through a difficult time, she pulls the note out of her Bible and she refers to it. She says it just stays with her long after her husband passed. I wish I knew what I wrote. I should have asked her, but I didn't want to ask her that question. It made me feel really good that I did have some type of impact on a patient. Another good memory I share is that I regrew the PACU, and the staff in there now are the strongest, brightest nurses that I know. They are professional. I often get remarks from the surgical staff saying that they can't believe what a change in that environment in the last few years. It feels like I have a wait list of their friends who want to come work when a position opens up. I'm proud of that, and I'm proud of my team.
Yeah, I'm sure you are. And isn't it funny just how little things, you write a letter, 20 years ago, and just to know, just in that case, but probably in many cases, you've touched so many lives over 29 years. And you talk about some nurses being there 40, 50 years. You talked about having a waiting list. If someone were considering a career as a nurse at Emerson, as it was your career path, what would you want them to know?
That this is a very nurturing organization. They really want to help to grow you professionally. They want to invest in you professionally. They want you to take advantage of certifications throughout your career. They'll advance you as well. I mean, I started out as a staff nurse brand new and worked up from charge nurse to clinical resource nurse to eventually nurse manager. They offer scholarship programs, there's nursing education funds, and they really encourage nurses to grow. You don't have to start out in one place and stay there for the rest of your career. They want you to work in a subspecialty area or train and mentor and stay within these walls, and it's just a fantastic place. That's why I've never wanted to look over the fence at anywhere else.
Well, it has been so great to get to know you today, to hear about your experiences. I hope that you get to sort of bookend the CEO's time there.
Yeah.
Really fun today. Thank you so much, Wendy. You stay well.
Thank you so much.
Visit emersoncareers.org for job opportunities at Emerson. And thanks for listening to Emerson's HealthWorks Here podcast. I'm Scott Webb, and make sure to catch the next episode by subscribing to the HealthWorks Here podcast on Apple, Google, Spotify, or wherever podcasts can be heard.